Hey guys, Dr. Aaron Ferguson with Excel Chiropractic and Wellness, and today we're talking about how chiropractic care can be a great fit for treating headaches. Now, when we have a headache patient present to our office, really where we start, one of the key important things for us is a good examination and case history. So a case history, we really want to understand what type of headaches you're having, what your symptoms are, what you've done to manage them, really how long they've been going on. From there, we really want to look into a good thorough exam to understand, is there a biomechanical, musculoskeletal reason as to why you're having these headaches. We'll do that through some orthopedic tests. We'll do that through some functional examination and really try to see if we can understand and pinpoint musculoskeletally wise what's going on and how we can address that. Now, if through our exam we find that there are some issues or some things that are highlighted that we think we need to shoot an x-ray, we are able to do that right in our office. We have digital x-ray in our office. And oftentimes we'll do that just to rule out if there are other issues or more serious issues that really is something we wouldn't treat and we want to refer out. We want to make sure that we're covering all of our bases. Now, from that in-depth exam, we're going to put together a treatment plan for you that's really going to address what your issues are and how we best can address your pain and discomfort. Now, our first goal with patients is, yes, to get rid of their pain and discomfort, but ultimately our goal is to fix their function and how they're moving and what's going on so we can prevent the issue from coming back over time. Now, in our office, the chiropractic adjustment really is our main treating technique. When we use the chiropractic adjustment, what we're looking to do is isolate and find what joints are restricted in motion and not moving like they're supposed to. When we can isolate those joints, what you'll find in those joints is as a joint is restricted and not moving through its normal ranges of motion, typically the muscles around that joint will spasm and cause problems as well. And when we have that going on for an extended period of time, what you'll find is we compensate and we move elsewhere through other joints to try to get our normal everyday ranges of motion. Now, the chiropractic adjustment, what we do is we put a specific force through the joint with the goal of restoring motion to the restricted joint. And when we can do that, what we do is we also restore motion to the whole motor segment and allow the neck and cervical spine to move like it's supposed to. Now, as I said, the muscles can spasm around that area as well. And we also think it's really important in our office to address the soft tissue aspect. The muscles in the joints, they are attached, they work hand in hand. We don't really feel that you can treat one without treating the other. So we use a technique called active release technique. That is really meant to address the soft tissue aspect, whether it's a spasm muscle, whether there's fibrotic tissues within that tissue. We want to make sure that we're addressing that as well with the soft tissue technique, and then also the chiropractic adjustment. Ideally, once we get things moving the right way, really important in our office is to also show you functional rehab, things that you can do to maintain and manage and not have these headaches over and over again. We may also look at your everyday lifestyle, things that you're doing and how you are sitting at work, how you're sleeping, how you're standing, all those things that can play a role over time, and try to modify those habits as well. All of these things coming together, we can get to a point where not only we reduce the symptoms of the headache, but we can really focus on how do we prevent those headaches from being an everyday thing. Really common in our office, people are surprised that they don't have to live with headaches, and ideally if you're having them, you won't have to either. I'm Dr. Aaron Ferguson with Excel Chiropractic and Wellness, and we'll see you on the next video.